Welcome back, everyone. We're all pepped up for a critical dialogue on employee well-being and health. I'm excited to welcome Neeloy Roy Chaudhary, Head of Sales Partnerships, Medix Global, and Jace Chandy, CHRO, Connect Business Solutions, Quess, as they ignite a critical conversation on democratizing employee health and well-being in an increasingly fragmented base location environment. Welcome, Jason Neeloy. The frame is all yours.
Happy 2022. Good afternoon. It's the era of the Great Resignation. I think we all know that. And we're not talking about the pent-up resignations from 2020 and 21. The Great Resignation is real. Gartner says that 65% of the employees are actually thinking and rethinking about their career move, and about 60% of the employers are voicing great concerns about attrition. The resignation rates are highest among, the mid-career employees, and are prevalent, the highest in the technology and healthcare industries. Besides many reasons, I think the two main reasons are burnout and lack of engagement. Employee engagement, I think, is one of the biggest concerns of CHROs today. McKinsey says that about only 25% of the employees feel engaged. Engaged employees with a positive experience are 8 times more likely to stay and contribute. Also, the other aspect is burnout. In fact, during the pandemic period, Gartner has reported 85% of the employees suffering from burnout, which is 2 to 3 times that of the pre-COVID times. We need employee engagement throughout the life cycle, right from onboarding to outboarding. As I was mentioning, only 25% of the employees feel truly engaged. I think the other point that comes out very clearly is that in this era of AI, machine learning, all the data points, the human-to-human touch is the most important aspect of employee engagement. And employee engagement leads to customer engagement. I think we all know that. Emotional intelligence, empathy have to be the prevalent part of communications that drive employee engagement. We've seen collaboration. We've seen very innovative volunteering schemes and initiatives. But the centricity today is on communication. So Jess, can you tell me what your esteemed organization is doing to foster communication for employee engagement in this era of great resignation?
I think very, very valid points you brought out. Some of the data points just highlight the importance of employee engagement and how people are kind of reacting to what is happening in the market, especially in the pandemic. Let me talk about what we did in the company. I think communication is the most important part, and many times it is the most underrated, underworked area, right? What we did, and there is nothing called over communication. You can always communicate and communicate and communicate. So to engage with people, I think get the basics right. People need to be spoken to. People need to be felt that there's somebody caring for them in the organization. So one of the things that we kind of instituted during the pandemic, and when a lot of people work from home, and continued when some of them came back to work, was to have a daily catch-up meeting. Getting supervisors talk to their team members, and it can be virtual, it can be people who are in now hybrid model, but having those daily connects, and those connects, not always is all about work. Many times it is talking about what's happening in their family. And when you meet people and talk to them, you get to get a sense of what's going through them. So we use technology, right? MS Teams, Zoom, whatever platform that you could work on, have people connect with you, make sure that you see them on literally every day, right? So that they don't miss that feeling of being away from the organization. So that helps. So you get a lot of insights into people and do that. The other thing is in terms of communication alone, we enhance the entire communication, focus some of the communication around wellness, engagement, good living. So we picked up a lot of content which is available from either Ministry of Family Welfare, Health and Family Welfare, and those kind of places, and started sharing that with people, talking about simple things. What should you do to have good sleep? What kind of exercises you need to do when you're working from home, sitting for long hours and things like that. These were then displayed on TVs on the floor for people who are working in the office, and made the screensavers on desktops, and regular emailers and WhatsApp messages or whatever. Those are things that we did during this period. The other was the informal connect. Now, what happens when you're at the office? You have a lot of opportunities to interact with people outside your team. Once it got into a work from home, it was very limited. You engage with people who are on your team, as part of your team, as part of your project, as part of your process. Now, we help people connect with other people or people from other functions or other departments or other teams. We launched an online hobby club. Now, what it helped is it brought together people who had some common interests. Either they had a reading habit, they wanted to do something about cooking, it could be about some sport. Now, people across multiple teams got together, shared experiences. They started interacting with them in a different format, right? Informal festivals, events, all that started. Now we went into online mode, got people to share their experiences, share pictures, share their thoughts. So it got connected. So I think communication plays a very, very significant. We saw the benefits of that. People felt much happier. And there are some very, very simple thing. Now I can give you one example. We had a activity called Ma Recipe. Basically, we wanted people to share a recipe, a food that the mother liked or mother cooks well, and along with a picture of the food, and you standing along with your mother. Now, what it did is that take a picture, they had to cook, right? Okay. And they have to also get a picture along with them. So it got people to do an activity which engaged them for about an hour and a half. Family was involved and pictures, and we had huge response. And in fact, we struggled to put all those pictures into circulation because the amount of pictures that we got was huge. So that's something that very simple. It doesn't cost us anything. For us, it was end of the day. We said that in the top 3-4 pictures, we thought that we may not get so many, but we said we'll reward those few people with something, a gift voucher or something. But the response, people are more happy to get them showcase with their parent showcase in the company. That is, I think, a very, very important aspect. The other thing was, we again felt there is a need for psychological support, and we tied up with an online counseling service. So that was another thing which helped a lot of people deal with issues around stress and things like that. So here is where I was, looking back, and where I thought, I think I will get some inputs from you as well. See, the entire org structure or construct has changed, right? With the organization is all about people, and there is people having these coffee table conversations, chit chat during corridors, lunch table conversations, and you meet people and talk to them eye to eye or face to face, right? And here, normally what happens is people prefer to keep the videos off during meetings, and so you actually don't get a sense of what's happening on the other side of the this thing. Human being is a social animal, right? There is a need for interaction, the need for socializing and those kind of stuff. And this virtual model has its own limitation in terms of what can happen. So I think there is a need to look at the well-being of the person from a not only physiological but social and psychological. And here is where I happen to see a interesting study and about annual health and well-being survey done by Optum, which talked about that about 78% of the organizations or the employers try and have these programs and to most primarily retain and attract people. So what's your thoughts on some of these aspects in terms of the whole wellness and well-being, which is getting a lot of focus right now?
It's fascinating. First of all, Jess, thanks for sharing what Connect is doing. And you really are an empathetic employer, I must say. And in fact, it's wonderful the initiatives that you're doing for employees. And I think that brings me to a very important question that you've thrown up. I think if you look at the whole pandemic in phases, the first phase was essentially about survival. So, collaboration, and then, the first on-ground fighting, the COVID pandemic itself, vaccinations, mental well-being. So we've been through that, and then after that, once the survival mode was over, then how to get the productivity up or the engagement up. So things like mental wellness and work-life balance and all, these were around, and you've been doing great, initiatives in that direction, care packages and all that. What we've realized in the past, 2.5 years, Jess, is that one is that healthcare or employee well-being can never be completely digital. Okay, exactly. All employees are unique. So with unique, I mean, we have, of course, lifestyle. We also have clinical aspects also. So, because of the COVID pandemic, a lot of us didn't go for checkups and all that. We have our blood reports, we have other, physiological things which are unique. We have lifestyle, we have, our own clinical aspects. We have our family aspects also. So, a lot of us have family traits of certain illnesses, and all that. And of course, we are diverse, ethnicity, food, and all that. So I think, first of all, healthcare has to be, or well-being has to be personalized. Second, it cannot be completely digital. There has to be a combination of digital and some manual intervention, some consultation, with the doctors or with the whole healthcare ecosystem, etc. Also, what we've seen is that especially in the second wave, I personally saw that, was that there's a lot of information around. There's too much of information, in some cases. So we need, a good stream of plausible, validated information, and employers rather have that obligation for the employees. Employees would look at the employees for the information. The second thing, what I've seen is that if you can, somehow catch it young or catch it in an early phase. So what I've seen also, and a lot of insurance companies have also reported it, is that for the past 2.5 years, we didn't go for a lot of checkups and a lot of other things. There's a lot of pent-up, checkups, pent-up disease, especially critical illnesses. So if you see the other diseases like obesity and mental well-being and all, your productivity can go up or down. But if you or your family has something like a cancer or a cardiac condition, then your whole productivity, your whole engagement goes down completely. Okay, so in this scenario, if you can have a prevention plan, or if you can catch it early, then that will lead to a good level of engagement. So what I've seen is that access to right information, personalized healthcare, a combination of clinical, family history, lifestyle, and mental wellness. So mental wellness is also linked to physical wellness of your yourself and your dependents. So in the second wave, we saw that many of us who had parents and who had relatives suffering in this horrible pandemic, we could not concentrate. So I think these are some of the aspects that I've seen are coming up to the forefront. A couple of very big examples I'll take. One is Steve Jobs. If he would have been detected early, we really don't know what might have been the situation. I came across this very interesting company, the World Diabetes Council. So they have this Compass program. They focus on emerging economies like India and South Asia, where we have a younger population, but there is a tendency for diabetes. So how to address diabetes more in terms of preventive care besides corrective care? So these are some of the, I think the good initiatives that are, I would say, are health and wellness version 2. We've been through the first version, and you've done excellent work in that. So I think this is what will happen. Omicron is around. We're seeing, the signs again. So this will be a going concern, and it's up to employers to provide that atmosphere, that environment of health and safety for their employees.
Yeah, very valid points. I think, Neeloy, that and you put it in perspective in terms of what are some of the challenges that are required for organizations. I came across this. If you remove the I from the illness and you replace it with V, it becomes wellness. So I think it is a collaborative effort. It is, I think, both sides and organizations, individuals, team members, society at large, and family all have to work towards this, and that's how this will help. I just want to pick your brain on what are some of the things that the leadership can do in this area. Some thoughts that you have, and I can then talk about some of the things that we have done.
Okay. I think you summed it very well. Replace I with we. I think that's a wonderful ethos. So I think organizations can have been doing a lot. They can do even more. As I was mentioning, and I think you've summarized it very well, Jess. It's a collaborative effort. So we need an ecosystem. The employee engagement portals, the health and wellness providers, a system of validating information, physicians and dependents. I think today what we've also seen is that employees today are looking at these aspects as essentials. So I've seen employees even forego fatter pay packages and go to environments where they're fostering the health and well-being of themselves and the dependents. So that is a big differentiator. So I think organizations need an end-to-end ecosystem driven by the top management and information validation. I would give a lot of emphasis to that. And and if the information, if the communication is done, and if the processes are communicated well to the employees, so employees know what to do. In the second wave, if we see, there was an overwhelming of the system because no one had the correct information. They would all go and land up. So we found that a lot of the people who did not need to be hospitalized, those were hospitalized, taking up the too much of a burden on the healthcare system. So I think the whole, and I think you've summarized it beautifully, that employers, employees, the medical fraternity, the government, they all need to work, hand in hand with this. And I think the key is the right environment, the right processes in place. If something happens, what are the processes to do? If we have the do's and don'ts and the guidelines and the workflows, of course, there would be exceptions. There's no doubt about that. But if we have these standard processes, we know what to do and not run helter-skelter.
Yeah, very true, very true. I think, information, right now we have overload of information, but we don't know which is the most right and valid information. So yeah, people do send across a lot of stuff on WhatsApp stating that you can get the oxygen at this place, and when you call up, that person says, I have nothing to do with oxygen. So I think, but yeah, one important aspect is the drive from the leadership. I think in terms of they need to make sure that they drive this and make it as important, like driving the entire vaccination process, driving the entire, making sure that you follow protocols and things like that. So yeah, they play a very, very crucial role. And I think pandemic has also made them realize that life is short, or it's too precious to just give away without making all the effort. So I think they're investing in it. I think a lot of companies have started working with players in the market who can use technology and even provide hybrid solutions. So I'm sure that's where it is going to go.
Absolutely. I think, Jess, that's a very valid point. So I think we have technology now at our disposal. So even during the pandemic, what we saw is that virtual reality, or augmented reality, and minimizing, human contact. So, solutions like that. And we've seen, companies actually shift production lines through AR, VR technology, through IoT and all that. We have those, those data points available. We have health and safety guidelines as well. So people who actually need to travel, things like rotation of shifts, vaccination passports. So I think it's a combination of guidelines, empathy, and leveraging technology, all these areas. And we have the data points now, and human-to-human interaction, it actually can be minimized also in some cases, and technology can take over. So what I've interestingly noticed is super teams. So super teams, human plus AI, I think that's working very well. Traditionally, we've noticed that technology is replacing mundane tasks. But today, if you look at the whole COVID response, it's been the technology that is supplying the insights and the processes and the technology, and human beings taking those decisions, the leadership teams.
I think the critical part is to get that high tech along with high touch. The way we lose that human to human contact, the organization will not exist. I think so. Yeah, balancing that, and with the COVID protocol of maintaining distance and not meeting people or traveling and all that. Yeah, we have to balance. I think it's a fairly close tightrope walking that we will have to do. But sure, I'm sure we will go through this, and new models will evolve. I think as organizations are evolving, I think things are morphing. If somebody had asked me, can HR be done remotely 2 years back, I would have been 100% no from me, right? But today, I think it's 70-80% of the things can be done. But yeah, there are parts of things which needs that interaction and where one-on-one has to happen. But I think it will evolve. That's what I'm hoping it will happen, and newer models, newer policies, practices will evolve.
No, absolutely. I think it's a policy. It's a combination of policies and technology, high tech, high touches. It's very important. I think in today's scenario, if you actually look at it, human to human interactions are what the competitive differentiator would be. So with so much of technology, and what we've also realized, Jess, is that employees are the cornerstone. They are the fundamental. You cannot have unhappy employees and happy customers. It doesn't work. So a happy employee will bring a happy customer, will bring a happy ecosystem and stakeholders.
Great.
Thank you so much for joining, Jays and Neeloy. This was really intuitive and very, very relevant. Thank you so much for putting out such insightful insights for us.